believe that we are getting started here now with our webinar. Hi, everyone. I'm Gabriella Celeste, and I'm a co-chair of the Ohio-led Free Kids Coalition, and really thrilled to be here with everyone this afternoon. A few housekeeping items I just want to put up front. First, again, we really want to thank our sponsors and to Co-Ohio and their staff in particular, Gina Witt, Parker, Dean, and Josh Johnson, who've been incredibly helpful with putting this whole event together and in the webinar. So thanks so much, all. And for those of you who are attending, please do use our chat box to ask questions. And if you have a question that's for a specific speaker and could direct it to that specific speaker, that'd be great. I'll be asking those questions. We'll probably save most of the questions for the end. We've definitely saved time to do that, but there may be a few that we interject with throughout the webinar. Also, for all the Ohio registered sanitarians applying for CEs, be sure to enter your name and RS number in the chat box now, and then again at the end of the webinar so that you get credit. So, but also, by the way, a survey is going to pop up right at the end of this webinar. Please, everyone, if you could participate in that survey, that would be great. And registered sanitarians need to then re-enter their information for that. Finally, this webinar is being recorded and will be posted after the webinar, so on the OHHN website. So we'll make sure that for those who are interested and who missed out on the webinar, they get a chance to see that recording. So moving on, I just want to say it as the moderator and as the co-chair of the Ohio-led Free Kids Coalition, along with Patricia Barnes and Timothy Johnson. Our coalition is made up of a number of organizations and individuals across the state who share a deep and abiding concern about the potential lifelong harm caused by lead. And we really work to secure and sustain a public investment in and commitment to preventing children from being poisoned by lead. We released an action plan for lead-free children earlier this year, which you can find on our website at ohledfreekids.org, a new website, by the way. And feel free to take a look at it and certainly consider joining the coalition. I see now the slides, I think, are showing some of the sponsors of this webinar as well. I do want to say that I'm especially proud to be able to be joining the members of this panel today and to be focusing on this topic, the State Child Health Insurance Program Health Services Initiative, better known as the SCHIP Lead Abatement Program, or the Medicaid funded lead abatement program, because it really is the state's premier child lead prevention program, and we see it as the vital part of the continuum of supports that are needed to really invest in a statewide primary prevention approach. So I'm going to introduce our panelists, and they're going to talk with us today about the SCHIP Lead Abatement Program, how it's currently working in Ohio, what we've learned along the way, what we should be thinking about for the future in advancing lead poisoning prevention. And if we could move to the next slide, I'll just say John Belt is the Field Services Section Chief at the Ohio Department of Health, which oversees the child lead program. You can see on each of these slides, there'll be more information, background about each of our panelists. After John, we'll be hearing from Pam Blaze, who's also with the Ohio Department of Health lead program. Among many things, she manages the SCHIP lead program. And so we'll be hearing from Pam after John today. After Pam, we'll be hearing from Jerry Kolkowski, who's the lead grant program manager with the City of Toledo Department of Neighborhoods. And then finally, we'll be rounding out the panel with Aaron Grant, who's the senior project manager with People Working Cooperatively, PWC Home Repairs in Cincinnati. So with that, let's see, we're going to start with John and then proceed on to these other panelists. As I said, I'll be monitoring the chat box, which we hope, it looks like we've got John's good. It looks like we've got John's slides up here. So let me turn it over to John, and thanks so much, everyone.
Well, great. Thank you, Gabriella. And, you know, I've got to start with, you know, we wouldn't be where we are today if it wasn't for the Ohio Healthy Homes Network and the Lead-Free Kids Corporation. And the work that Patricia Barnes and Gabriella Celeste and everyone else involved, if they weren't out there advocating and doing a lot of the work that they're doing, we wouldn't be sitting here today talking about this successful program. Also, I've got to send out kudos to Pam Blaze, Chris Alexander, Seamus Estep, and recently Danya Nixon, who are all part of the management team in the field services section. And, you know, it's really those people that make these programs work, whether it's the SCHIP program or several of the other successful lead poisoning prevention programs we're operating in the state. So, you know, nothing happens because of one person or a few people. It really is a statewide effort to make these programs successful. With that, I am John Belt, and I am with the Field Services section and Bureau of Environmental Health and Radiation Protection with the Ohio Department of Health. We've been with the Bureau of Environmental Health now for probably going on 6 years. There was a reorganization in the agency, and we originally cut our teeth with the Bureau of Maternal and Child Health. So we really have walked both sides of the fence. And I think that understanding of kids and moms and that side of the fence brought with environmental health gives us a well-rounded, robust program. Next slide. So I'm going to set the stage for all the good work that Pam, Jerry, and Aaron are going to share, because certainly several $1 million doesn't just show up without a lot of effort and a lot of work. And our greatest partner in this is ODM, which is the Ohio Department of Medicaid, and lead poisoning prevention program. The Ohio Department of Health has had well over a 2-decade or 20-year relationship with the Ohio Department of Medicaid, starting around 1999 when they started to fund public health lead investigations on a very limited basis, and that's grown into a statewide effort. Our data sharing and data management, which if it wasn't for funding through the Ohio Department of Medicaid, we wouldn't be able to host data, as most of you have probably seen on the Ohio Data Warehouse. If you ever track the real-time lead data, most of that is the result of base funding from the Ohio Department of Medicaid to get our surveillance systems updated and rewriting the language and so on. So building on that history, it seemed only natural that we partnered with the Ohio Department of Medicaid to create the state plan amendment for lead safe housing and lead abatement activities. And I'm going to get a little deeper into the lead safe housing, but that really funds the Ohio rental registry, lead safe rental registry. Next slide. So, you know, I've got this slide up here because does it really matter what came first? These lead hazard control state plan amendments originated with the state of Michigan, and it was really a Medicaid-driven activity that then pulled in the health department in Michigan, but it really laid the groundwork for then the state of Maryland to put together a state plan amendment seeking money for lead hazard control. And I know early on, Pam and I were looking at these activities, and we had already started discussions with our partners at the Ohio Department of Medicaid when in 2017 statutory language came out in directing us to pursue a state plan amendment and providing some seed money for the match. Does that matter? No, it doesn't matter. What matters is the end result is that we have it in place now and we're actively funding this initiative. Next slide. So I'm trying not to do any acronyms. So Centers for Medicaid Services, CMS, that's the federal government level. I believe 49 of the 50 states have Medicaid. States are not required to have a Medicaid program, but obviously it's the only way to go because it's primarily federal funded. So you certainly want to have a Medicaid program. So you have to follow CMS rules and, the entire statewide program. And so obviously it's essentially a contract between the state of Ohio and CMS, or the federal government, that the state will do X, Y, and Z, meet the minimum requirements that the federal government has as far as services, eligibility, and so on. Then states can build on that agreement and they can expand on it. So if we view it as a contract and the state of Ohio decides that we want to start offering lead hazard control services or other additional services outside of the minimum required by the federal government, it's synonymous with amending a contract. Next slide. So a SPA, a state plan amendment, is simply an amendment to a contract. And if we look at it that way, it's really easy to understand. We have a contract with CMS. Ohio Department of Medicaid would like to change that contract. So then an amendment to the contract's proposed, it's submitted to CMS, and they either approve or accept it. Now that sounds very simple, but it's not. Next slide. So our amendment leverages up to $5 million a year in new funding for lead hazard control, lead safe rental registry, and some marketing involved with these activities. What really happened was in July of 2017, when we were mandated with requesting this state plan amendment, behind the scenes between ODH and the Ohio Department of Medicaid, we worked until October. So 4 to 5 months of crafting the state plan amendment, providing drafts to CMS, getting recommendations back, responding to some basic questions. And there was 4.5 months of very hard work. It went into creating the state plan amendment. And then in October of 2017, it was actually submitted to CMS. Well, by then, all the background work had been done. So in about 6 weeks, by December 6th, it was returned approved from the Centers for Medicaid Services, returned to the Ohio Department of Medicaid, who then notified us the state plan amendment's been approved and it's retroactive to July 1st of 2017. So now it's pretty much the holidays and we're being told, hey, you're already 6 months into this. Have you spent any money? Well, that's where Pam and her team come into play, because being a state entity, we can't contract, spend money, or take services until we actually have funding for this effort. So between December 20th and January 30th, Pam put together the basic program, secured a contractor, and by early spring had actually started to produce some units. And it's a lot of work and nobody ever sees the effort that goes in behind the scenes. In addition to the lead safe housing, I did mention the lead safe rental registry. That's a statewide site that individuals can search for lead safe subsidized housing. by zip code, by city, by county, and that's all part of our package. And also, well, next slide. Also, we had our state plan amendment had 2 phases. First phase was to control lead hazards where they've been identified as a result of a child with an elevated blood lead level. And we have phase 2 written into our state plan, which is the primary prevention phase, which would allow us to expend funds to make homes lead safe in the absence of a child with an elevated blood lead level. Because our priorities obviously are children who have an elevated blood lead level, and every one of those should be treated as if they're a medical emergency. We've not been able to advance to phase 2 or our primary prevention activities. So as we go on in this and get down to the questions, I think we'll be able to discuss a little bit about what phase 2 could look like and how that might be implemented. Next slide. So I love this, because our goal with the Medicaid SPA was to do abatement activities only. And most of you probably know that when you're doing lead hazard control, there's a lot of things you can do. You can do paint stabilization. You can do other activities that really don't eliminate the lead hazard, just make that safe for a couple of years. So with peer abatement in mind, Pam's team started to produce units that, this is a prime example and one of my favorites, because it was truly a removal and replacement. It created some units or homes that I would live in. This home went through the program and was one of the first ones we produced, and it just turned out phenomenally. Whether you look at the coil stock around the windows, the replacement windows, the soffits, the siding, all the work it went into it, inside and out. Next slide. And when we're talking abatement, this is the same home, but if you look at the porch deck, we're truly talking about removing and replacing. So this home was built with tongue and groove decking on the front porch. So rather than exterior plywood or maybe the green AstroTurf carpeting we're all used to seeing on lead abatement jobs, we spec'd in removal and replacement of the porch deck. And it really isn't that much more expensive. And we left the home here that the occupants, I'm sure, are proud to live in and very happy with the program. Next slide. So I like to end a lot of my presentations with this disclaimer. We always talk about things being safe, and we've got to remember that safe is not necessarily protective of children's health. It's a relative term, and it really is a balancing act between industry, policy, and advocacy. And I put a couple examples on here. Obviously, we all know what the action level is for lead in water, 15 parts per billion. We know the lead dust clearance level and hazard levels will be dropping, and in some cases have dropped to 10 micrograms per square foot. When this discussion started, that was considered safe for children, but there's new research coming out every day, so we have to start to question these. And really, an example that anyone can relate to, even if you're not in the lead industry, is this last one I put in. And LD stands for lethal dose, and so that's the lethal dose 50 in pesticides. Anybody that has, say, malathion or savin or chloridane out in their garage from their garden insecticides or their ornamental plant insecticides, if you look carefully on that back label, every insecticide is required to have that LD50. And what that is the lethal dose of that particular insecticide in 50% of the population. So if I have a quart of malathion and we all drink a pint of it, half of us will die, but half of us will live. And that's just a great example of safe being a relative term. If I was one of the lucky ones that lived versus one of the ones that died. Next slide. Thank you very much. And I look forward to Pam and Jerry and Aaron.
Thank you so much, John. Appreciate that context that you provided for us. Pam, tell us how it gets done. Turn it over to Pam Blaze here.
All right, hopefully everyone can hear me. Thanks so much for having me. I'm really excited to share the development over the past couple of years with this program. Definitely is a lot of work has gone into it by various individuals within the health department, that of Medicaid. Very happy to work with them continuously on a lot of these projects. They've been so supportive on everything that we've done, whether it be lead investigations or moving into for this new concept of lead hazard control and using Medicaid dollars for that. So I gotta put a shout out to them. Next slide, please. So again, this is kind of reiterating what John already mentioned about the spa. You know, originally I thought maybe the spa was I could go in and get a mani-pedi and that type of thing and get a massage or something, but then realized, no, that's not what this meant. That certainly would have been nice, but there was state plan amendment, like John said, and each state is also allocated with their Medicaid dollars, the funding that's health insurance plan, so the SCHIP dollars. And with those dollars, you can formulate what's called a health services initiative. So John already mentioned a lot of that, and we put a lot of background work into, you know, writing the SPA, what the SPA would look like. And incidentally, most SPAs are, again, amendment to a contract, but are usually good in our experience for 5 years. So it started in 2017, so we're going to be quickly approaching the end of that SPA to where we'll probably have to amend it again and work with Medicaid to get that submitted. So this health service initiative with regard to lead or the realm of healthy homes really wasn't started by us. And actually it wasn't even started by the state of Michigan. It was the state of Missouri that sought out a health services initiative for asthma and also some lead hazard control. So they are really the ones that kind of led the pack, so to speak. But although, as John mentioned, we were already in discussions with Department of Medicaid to kind of get this started. So again, those M states, Missouri kind of led the way. Michigan has $25 million a year, but the vast majority of those dollars go for lead service line replacement. So I'll get into that a bit with regard to Ohio, but they use a lot of that funding to replace the lead service lines in Flint, Michigan. So, but initially, again, when you look at the background regarding this, the SPA was the guiding document. So we had some thoughts in our mind as to what it should look like, and that just kind of ended up on paper. And what was the background for that? Well, we have a HUD grant. So what's kind of been the guiding principle with a lot of the lead hazard control funding that's out there right now, it's the HUD grant. You know, if you have a HUD grant, they have, you know, regulations that they have in place and what should be done, you know, and policies and that type of thing. So we wanted to model it. I mean, it's a successful model. So we wanted to use that model, and that's what the information that we use to formulate the state plan amendment and then for the health services initiative. Next slide, please. So again, this health services initiative is designed to improve the health of low-income children. So we wanted to, of course, accomplish that through this HSI. And so any state can apply for it. So it's one of those things that you may want to keep in mind for the future, you know, as we start to get into more, you know, healthy homes related items. That's something that we may consider long-term, but right now it's just lead. So I want to make that clear, but that's certainly a way to kind of get some money surrounding these issues and make it available to low-income population that are on Medicaid. So next slide, please. So we have received $5 million per year for fiscal years 18 through this current fiscal year for 2 specific projects, the lead abatement activities and then the lead safe rental registry. The vast majority of the funding is going for the lead abatement activities, with a small portion of that dedicated to the lead safe rental registry. We required to go through the legislature to get the match funding. So initially that put some restrictions on our program that we just didn't want to be there. Largely that was the contribution required of the rental property owners, which was 50%. That was it was extraordinary, and it was a hard hurdle to break. But it definitely kind of set us back a little initially. So that had to be approved in the state budget. So that kind of set the tone for the program in the beginning. And $5 million at first, like John said, we had to cobble together contracts, put out an RFP, and identify a statewide vendor. That's the best, most successful model for our organization, because it's really hard for us to put contracts out through our agency. There's a lot of red tape involved, and we really just needed to use a successful model that we've used in the past, which was using our third-party vendor. So we put it out for RFP, and the only game in town, Better Healthy Environments, is the only applicant we got, and they are our statewide vendor. Next slide, please. So phase 1 of the project was intended for those properties where we have lead hazard control orders. So it's more secondary prevention in nature. So we have individuals who are under an order by our health department or by one of our 11 local delegated boards of health. So it is a statewide project. We are able to use the funding in all 88 counties are included. So this phase 1, we wanted to dedicate toward those properties, the worst of the worst, where we know for a fact they poison children and they have gone through, you know, the lead hazard control process and have this order now on their property, whether that be a first order or a second order, a notice of noncompliance in order to vacate. In theory, those should be vacant, but in reality, those are still a home to some people. So we wanted to be able to provide them the funding, most likely to have a second order, because of the fact that they haven't had access to the funding to make the necessary repairs. So initially, we didn't establish a maximum. We wanted to go full bore with the abatement, and you saw the results of that with the picture that John showed. It was really great work, and we were making some homes really nice. But when we started to get into some of the higher cost projects, and we weren't using any other source of funding, we really were starting to see some very high cost projects that were starting to make me feel very uncomfortable. To know that a property is only worth $30,000 and we're sinking $90,000, yes, we did that. $90,000 into a property was not setting well with me or anyone at the health department, really. So we had to re-examine our processes. We have a policies and procedures document that we formulated, and we try to follow that to the T. So we re-evaluated with the input of BHE, our vendor, of, you know, what would be best, you know. So we had to get to the point where we established more of a maximum per property. So that kind of came in maybe about a year or two after we started to see some of these higher cost projects. And I do want to say the $90,000 project, there were 12 individuals living in the home, and they were living in poverty. So I don't feel bad about the fact that we made it a livable home for 12 people, 2 of whom were severely lead poisoned children. So I do want to say that it wasn't money that was spent for naught, but we really had to kind of rein in the cost. The work that we've noticed just in comparison, our average for this phase is $50,000 per property for maximum per property. That means when we draw up the estimate, that's how much we are kind of capping our spending at. And then some decisions are further made as to whether or not we're going to pursue the property if an estimate comes in over that $50,000 maximum. So getting into that, you know, that kind of helps guide us a little bit better about the spending of the funding. We still wanted to shoot for the more permanent control measures like the abatement, but now we're finding ourselves incorporating more of those interim controls into the process. always want to do full siding or siding replacement if necessary. So installation of the vinyl siding versus paint stabilization. That's always something that we'll do. So one of the things that we got into is that there were some major issues with our lead hazard control grants, and we've identified that interim controls on the exterior are just not a good way to go. So that's one thing we did dedicate ourselves to. In addition, you know, if you want to compare it, $50,000 maximum per property versus HUD, the average property that we have is $12,000. So that's rather significant. So on the regional level, we have branched out. BHE is no longer only vendor with this project. We wanted to take a more regional approach. So we do have, and we'll hear from Jerry and also Aaron here in a bit, about a more regional approach with this. We feel like the communities can do a better job of kind of spending the dollars and grading with funding. So that's why the maximum is lower with those projects. It's $20,000 with those regional projects. They don't have some of the expenses too. Like if you have a statewide project, you're traveling 2 or 3 hours. Also, you're bringing in contractors in some of those rural areas that, you know, the cost is more significant than we see in some of those localities. So that's the reasoning behind that. So that's kind of phase one. So again, lead hazard control properties. And then next slide, please. Eligibility for those, for all these, phase one, phase two, I just want to make it clear, that probably should have come first, but the property must be occupied or visited more than 6 hours per week by a Medicaid eligible child under 19 years of age or a pregnant woman. So that's what qualifies the unit for eligibility into the program. So you can see that's pretty vast. I mean, we're finding that, you know, as we got into the program, we were having no issues identifying qualified families. So that does make things a little bit easier with regard to income verification as well, because that's the only thing that we need to do to verify income. If the child's Medicaid eligible, then, and it's been confirmed by Ohio Department of Medicaid, then we are good to go ahead and get the family through the program. So as compared to HUD, you have to do income verification, third-party verification, et cetera. There's mountains of paperwork associated with that. So the ease of that is so much easier for us to deal with. So it makes it getting a family enrolled to the project a lot easier. So next slide, please. So in conditions of enrollment, the property has to be built prior to 1978 as verified by the county auditor's records. At one point, this is where we made the change, the SPA amendment, you were required to have homeowners insurance. Again, one of those things that was required by HUD at the time, that was a huge barrier to a lot of families. So we eliminated that. It also has to be covered by flood insurance if the property is in a floodplain, and it has to be current on all property taxes or have a tax payment plan in place. So next slide. So, and we want to do, again, the lead abatement activities in this phase one, lead abatement, base paint, dust removal, soil remediation, window, door, floor treatments, et cetera, you can see here. And then the SPA amendment also included a water component. So we did add that with this latest amendment, which was in July of last year. So we have the capability to conduct fixture replacements and lead service line replacements, but I'll tell you that the priority is the lead hazard control. We haven't even addressed the water issues. We've been able to spend down all the money without even considering the water. But in the future, we want to do a more comprehensive approach to the home and may include this water component to it as well. But we do have now that capability at least. So next slide. So, okay, project one, again, this is phase two. So initially, again, when we were writing the SPA and we were looking at what, you know, we want a primary prevention component to this. We want to be able to do some primary prevention. That's the major piece our state is missing. How can we incorporate that into the SPA? And so we did have the capability to kind of do the phase two approach, would be strictly primary prevention, but it kind of spiraled into something else. So And basically what happened was, okay, we got into phase one, we started that project, we were enrolling on the lead hazard control ordered properties, and children were poisoned. And then we kind of started to see the numbers dwindle a little bit. So I was like, oh man, we'd really like to do one of these more focused projects than one of the counties listed here, but we weren't really prepared to do it at that time. So because of the fact that we were just really getting started in the project. So then we did a statewide marketing plan that was, went out to all the counties and worked with Singleton Marketing. I spent about $200,000 so we can kind of reinvigorate those numbers. So again, phase two was meant more to be a very specific community on a level, a census tract level, but it just didn't evolve into that. Not yet. I still have hopes for that. It evolved more into a situation to where we were assisting families that responded to the marketing. So that means that they were under an order, they didn't have a lead poison child, but we were still doing primary prevention. It was just as a result of our marketing efforts. So it was a kind of a call into our agency. If they met the criteria, regardless of what county they lived in, then we would enroll them into the project. So that's how we got into a situation where we had a huge backlog. So, and we're still trying to resolve that backlog. So we have probably in this, what we call this phase two, again, not necessarily more targeted approach like we on the census tract level that we'd hoped. It's evolved more into this primary prevention approach from a statewide level. So that's where we're at. But I will mention that with our new contract with the City of Toledo and also with people working cooperatively, we have been able to, that it's kind of setting the groundwork for that. We're still responding. The referrals we're giving to them are still phase one referrals, a lot of them. Toledo's getting some phase two referrals, but the phase one, again, we're still addressing those properties where we have families dealing with orders or lead poison children. So next slide, please. So in the phase two, again, rental registry, John mentioned that was or project two, I guess I should say, rather, was the second piece of this. And like I said, most of the funding was dedicated toward the lead hazard control activities. This lead safe rental registry was something that was kind of, I won't say forced upon us, but it was forced upon us. It was kind of an initiative that we saw from a previous administration. And the thought was, well, let's throw out a voluntary statewide rental registry. And we really didn't have any funding to kind of back that up. So we thought that this would be a good way to get the funding necessary to get it started. So again, not a lot of dollars go into this, and there's probably a lot more to be said about the lead safe rental registry, which I probably don't have time to go in today. But the purpose behind it is a voluntary rental registry that, the intent was to get property owners to list their properties on this rental registry so we could have it available. And we've done a lot of work around it. It's been great. I think the groundwork's been laid for a greater, maybe more permanent registry, but I don't want to speak too much on that. I just want to give you the basics that at this point in time, we have about 196 properties that are listed on that registry. And I know John's done a lot of work on this. So, and I commend him for his efforts in working with the Ohio Housing Finance Agency to put this together. So we're getting there. I think it's making great strides in getting the numbers to bolster on this, but that is also part of this project as well. So, and there's some bits and pieces on the slide if you want to take time to look it over, but I don't want to kind of waste our time on that. Move on to the next slide, please.
Yeah, and Pam, we've got just a couple minutes left if you don't
Okay.
mind.
All right. Thank you. So as I mentioned, the SPA revision eliminated so that was in July of last year, eliminated the requirement for rental property owner contribution in the homeowner's insurance. That was huge. That was preventing so many people from participating in the program. So definitely a step in the right direction with that move. It also included, like I said, fixtures and indoor plumbing, laying the groundwork for us to be able to address water issues in the long term. And it also included training for community health workers. We haven't gotten into that yet, but that's definitely laying the groundwork for that as well. Next slide, please. So by the numbers, you can see phase one, we've the number of children that we've served, 423. Down at the bottom, though, kind of the numbers as far as how many properties we've addressed. In phase one, we've addressed 151, and this is cumulative. 151 properties have received lead hazard control services. Phase two, we've addressed 68 properties, and you can see the average cost per unit. So we're not hitting that high number of 50,000, but we've had some lower cost projects. But with that phase two, ironically, those are properties that are not under an order. Those are the higher, where we're seeing some higher costs. Don't know why, not quite sure. I don't know if the lead hazard control orders are kind of narrowing the scope of the work, but those are definitely about $10,000 more. So I'm not sure why though. Next slide, please. So again, I don't know where this, okay, next slide. Next slide, I already talked about that, sorry. So SCHIP timeline, just to give you a sense, we got the SPA approved in 2017. We finalized our contract with our statewide vendor about December, fast moving. We had already started laying the groundwork for that. We are incidentally coming to an end of our contract with VHE, and we'll be putting out another RFP for a statewide vendor. Obviously anyone's welcome to apply. That will probably be at the end of next fiscal year around that, or I'm hoping to have it posted before then, so we have a vendor in place by July 1st of next year. Our first project in phase two was completed in June of 2018, and our first project in phase two started in September of 18, and then the lead safe rental registry language is finalized. So I haven't really mentioned a lot about the City of Toledo contract and also the work with, because I'm hoping they'll elaborate on it, but we did seek out and want to start the groundwork for working with local communities. We realized that it's not a great structure to have a statewide program. It's just really hard to implement, and VHE has been great because they've been willing to do the work, but there's some areas that have some specialized regulations that make it more difficult to work with, City of Toledo being a prime example. So great to have them on board. Those contracts started this July. So again, it kind of leads me into the foray, hopefully, of letting them speak about kind of how this all formulated. So I'll leave it at that. I think that's my last slide. Maybe not. Can you, next slide, see what's, just here's some more information. Challenges, you did mention that. I'm telling you, some of this has been difficult because of some of these things. We have a really hard time getting started again after we have a lull. This past year, we spent all our funding by December. So we kind of went out of commission for a while, for about 6 months. It's really hard to get things moving after you've been off that long. So we do have an extensive pipeline of participants, like I said, so maybe not enough money to help all the people we could potentially help. The shortage of lead abatement contractors is a universal issue throughout the United States, not anything new there. The quality of the lead abatement work, I'd like to see it a little bit higher. I mean, it's not been the best work. And then our red tape with contracts, I mentioned that. It takes us forever to get a contract in place internally. And then as of late, the possible COVID-related issues, such as material shortages and some price increases and stuff like that. So next slide. All right, that's it.
Thank you. Thank you. And we did get a question here that either you or John could probably answer quickly, and then I'd like to turn it over to Jerry, which was just whether the homes that go through the SCHIP lead program also need to go through historical review similar to the HUD lead hazard control grants.
Yes, they do need to go through SHPO review, and we did secure one person at our state historic preservation office on contract. So we used this funding to be able to have this funding and a combination of HUD funding to have a person dedicated in that office to review just our project. So yes, you still have to go through SHPO. Yes.
Wonderful. Okay, thanks for that. Really appreciate your review of the program and how it's been operating. And hopefully we'll have some time at the end for some more questions. But Jerry, we'd love to hear more how this has been from the perspective of a local government that sought and received one of the grants. And, and I know you're with the Department of Neighborhoods there, so if you could, we'll turn it over to you.
Sure. So one, I want to introduce myself to everybody again. So I'm Jerry Kolkowski from the City of Toledo Department of Neighborhoods. You can hear me, but you can't see me because I'm actually testing out my Halloween costume as the Invisible Man today. So hopefully everybody gets that joke. But before I go into a whole lot of detail, I thought I would give a little bit of background about the City of Toledo. Right now, we've got a total population density of about 270,000, a little over 270,000. It's actually been in consistent decline over about the past 10 years. And we all know that when population declines, housing stock also, let's say the quality of housing stock also declines as well. We've got basically around the total housing stock numbers of about 145, actually almost 146,000, with about 32% of those being constructed before 1945. Our average household income is a little over $50,000. We got a poverty rate of about 26%. Based on the age of the housing stock, income levels, number of children, which we've got about 20,000, a little over 20,000 children under 6. Actually, all of our 16 residential zip codes in the City of Toledo are considered high risk for lead poisoning. Whether it's SCHIP, whether it's the HUD grant, we definitely are always looking for ways to address lead paint hazards in our city. So, excuse me. If we go to the next slide. Basically, the City of Toledo Department of Neighborhoods, we administer and operate a number of lead hazard control programs. Majority of them have been and are HUD funded. We have one that we're looking to get under contract soon, which is privately funded. And then most recently with the SCHIP program. We did finalize our contract, although it's a July 1 start date. As Pam had mentioned about the challenges of contracting, July 1 start date, but we actually finalized the contract near the mid to end of August. Now, basically, we're looking at, we're targeting to do 20 units. It's a total budget of $500,000, but we're looking at putting in $20,000 per unit for the lead hazards. So, next slide. So intake and enrollment. So my personal experience over the past, 7+ years working with, let's say, government-funded programs is that it is just so difficult to get applicants actually, eligible and enrolled, because it just takes so much documentation has to be submitted, et cetera. One of the great things with the SCHIP program is when we get the units referred to us, they are pre-vetted. So they're already pretty much enrolled. We just have to follow up with just a few initial documents to get signed by the property owners and the occupants. So it significantly, let's say, decreases the time to actually get moving on a unit itself. So that's one of the great things about this program. And again, significantly different from our HUD grants, where we've got to collect just, everything and the kitchen sink just to, prove the eligibility for it. So next slide. One of the things with this program, and a significant advantage to us as a partner with the program, is its potential to leverage and match funds to address high-cost units. One of the things that we've run into is we've got a lot of projects that as a HUD grantee exceed our limits for HUD, and with the SCHIP program, we're actually able to refer some of those folks that would be eligible. So we look through to see if they, if they receive Medicaid, et cetera, and we make the referral to the folks that we're already working with to contact the SCHIP program, see if they can get enrolled in it. And as a matter of fact, when we got our first set of referrals from ODH, there was actually a few of the folks that were already enrolled in the SCHIP program we were already working with, trying to figure out where we were going to get the additional funds to basically get all of their work done. Now, from us, from our standpoint, as the slide shows, if they're already enrolled in a HUD program, it's very easy to get the referral over to the SCHIP program and keep moving forward with it. If they're, and we haven't run into this yet, if it's starting as a SCHIP referral and it runs into a, let's say, a high cost unit, I'm sure that we will be able to get them enrolled into our HUD program, but then you get into the significant amount of extra documentation that we have to collect for that. So, but yeah, so for right now, though, we're looking at this as a great way to, further leverage our own, the funds that we already have. Next slide. So the learning curve, keeping them all straight. Basically what that comes down to is it seems like every lead hazard control program that we work with all have different requirements, whether it's initial eligibility, whether it's the work you can do on the unit, whether it's the grant cap, et cetera. So one of the challenges right now is knowing which programs that we're working with. So the, if it's a HUD program specifically, or an SCHIP program specifically, or it's a combination of the two, or one of them that's privately funded. So that's one of the, I'll say, one of the things that make my head spin. But fortunately, I have a pretty good sense of it, and I'm the one that works with our rehab staff when we're writing the specs and looking at costs and all of that, just to make sure that everything meets the requirements of the individual funding sources. And then one of the ways that we also, I don't want to say combat it, but one of the ways that we address the individual funding sources is when we do have a project that is utilizing additional, or say multiple sources, we actually put a contract together for each individual funding source. So if we're leveraging the SCHIP with our HUD program, we will have two separate contracts that break out the work specifications for each one, so we can keep the funds segregated, and as well as show when you put them all together how they, how both contracts actually made the unit lead safe. So next slide. So yeah, this is just an example of one of the units that we've done. The before and after, if you can't tell, the blue half is the after half. I guess that would be peach or pink is the before. So just a sample of what our programs, our lead programs do in Toledo. And then the next slide. So here's my contact information. Presentation was short and sweet. I'm actually, I have heard about, or let's say heard about and been part of discussions about using Medicaid dollars to address lead paint hazards for a number of years at conferences across the country. I'm actually happy and excited to be actually part of it in the state of Ohio at kind of its beginning. So that's why I'll say my presentation is a little bit short and sweet, because we're just getting into it, but my contact information is up there. Feel free to contact me at any time as a resource for questions, whatever it might be. So I'm always happy to provide any knowledge and experience that our programs have had over the year to anyone who's interested. So
thank you, Jerry. Thanks so much. And you guys have a few balls up in the air there in Toledo, so it's great to hear about this work, and we look forward to hearing how it goes. I'd like to turn it over to Aaron, who's with People Working Cooperatively on home repairs, and also really brings this perspective as a nonprofit. Aaron? Great.
Well, thank you. Tough acts to follow here, but I will do my best. So excited to be joining you here today to talk about People Working Cooperatively's role as a local provider for the SCHIP Medicaid grant. So real quick, if we can go to the next slide, I just want to introduce people to People Working Cooperatively. So with apologies to folks that already heard this in our first webinar of the week. So we're essentially a nonprofit construction company. We're an independent organization that does a range of home interventions to help people, live safe and healthy at home. It runs the gamut from our critical home repairs, to energy conservation, to accessibility, and lead abatement services so that people can stay independent and healthy in a safe and sound environment. We work in Southwest Ohio, Southeast Indiana, and Northern Kentucky. So we're in 18 counties in the metro area. We're in about 5,000 households a year across our various programs, and we're very, very fortunate to have over 3,500 volunteers that donate their time to PwC and our clients in some way in a given year. And while we serve, most of our clients are under 50% of the regional median income as defined by HUD. Many of those folks earn far less than that. So the plurality of our customers are very low income folks. We can go to the next slide, please. So the newest initiative from PwC is our Whole Home Innovation Center, and this is really our attempt to get beyond, not just doing direct service delivery, though that's extremely important. We want to continue doing those things, providing services directly to low-income families with our staff technicians. We also want to start thinking more broadly about how housing connects to health outcomes, and really focusing on that link and using the Innovation Center as a way to go upstream and addressing some of the root issues that really affect the housing conditions that our customers live in. So we want to do things like education, whether it's fall prevention education for seniors, whether it's education on how to keep your home asthma trigger free for people with asthma or COPD or other respiratory conditions. We provide modification services on a fee-for-service basis for people that are above our income guidelines as our social enterprise, so we can leverage that expertise we've built up doing this work for years and do that at a market rate and reinvest that revenue into our nonprofit side. And then essentially, this is our space to do R&D. We get to, whereas our traditional programs are usually pretty tightly bound by different restrictions on how to use funds and where we can use them and who we can serve. This is a venue for us to try to really broaden the stakeholder pool and think about different ways that we can engage the broader community in housing as it relates to health outcomes. We can go to the next slide, please. So what are we doing here with the ODHS CHIP program? I don't want to duplicate some of the things that Jerry has said, so we may skip a little bit of this, but we were very excited to have the opportunity to bid on this RFP, to be part of the solution for the local SCHIP grant program here in Hamilton County. We can go to the next slide. So back just a couple. So we do intake enrollment. So once we get the referrals from ODH, the folks that are already pre-qualified, we go through the remainder of the eligibility process for those folks. As Pam mentioned, it's a lot easier than some of our traditional HUD-funded programs, but we still want to make sure we have all the documentation that we need. It's a little trickier now, given the COVID-19 environment. We prefer in-person interviews, but the enrollees have been really good about corresponding by email, over the phone, dropping off materials as opposed to having an in-person consultation. So that's been okay so far. And then we also do the lead inspections and the risk assessments, and you can see that goofy guy there. I've got all my PPE on, my COVID-19 safety kit with my N95 mask and my Tyvek suit. So we do these for all enrollees where a public health investigation has not already been done. So a number of these referrals come from public health investigations or from orders have already been issued. In most cases, we don't need to do another one. There may be a few follow-up surfaces we need to test or something that we need to verify, but so we do those for the homes that have not already had an investigation conducted. Obviously, COVID-19 has made this tougher given the amount of time that you're spending inside the living space when you're doing these assessments. So we try to be extremely thorough. So in a single family home, I may take anywhere from 300 to 400 individual shots with an XRF analyzer, so I can be there for 4 to 6 hours. So it's really important that we find a way to not be sharing the same space and breathing the same air while we're doing that. The customers we've served so far have been very good about being outside the home to kind of let me move about the house without anybody being there, and that helps. I still gear up the way you can see here. I try to keep all of my equipment on my person, so I can't just drop my toolbox on the chair or on the kitchen table. I look pretty cool with my backpack and my fanny pack and all my equipment kind of strapped to my chest, but it's just, we have to be very careful now about what we touch and where we leave our things. So anything I do touch, I wipe down with a Clorox wipe, whether it's a door handle or, window sash or whatever. The interviews we usually try to do in person, and I usually don't mind having the resident follow me around and ask questions and say, hey, is that lead? Is that lead? I'm usually happy to do that. We can't do that this time, so or right now. So we have to have all these conversations about where the children spend their time, where they sleep. We have to do that over the phone or by yelling at each other on the front porch. But so far, it's been okay. So once the risk assessment's completed and a series of recommendations are made about the control measures with a preference for abatement measures for identified hazards, we also develop the work specs. And that is where we had a question earlier about SHPO. We will develop the work specs based on what we think the most appropriate measure would be to abate the hazard. We submit those to SHPO for their approval. These are old homes. The ones we've looked at so far were built in the 1910s or 20s or 30s. So, it may come into play where there's a historic component that needs to be either saved or remade to fit the character of the home. So SHPO guides us there. Once we have the specs developed, we get review from ODH, and then we put those out to bid. And you can go to the next slide, please. So procuring bids from the local contractor pool. So one of the things that we've been doing, and I think one of the advantages of a local approach to this is that, for years, PwC has been part of that lead abatement contractor pool. We've done this, working as a contractor for the city of Cincinnati's lead hazard control program. So we're kind of part of that network, and that's helped us try to bolster the local pool. So we get a good crew or a good assortment of people that are putting together project designs or putting together bids for these projects. So our program manager, Steve, has been trying to work with some of these contractors to get their ducks in a row, to help them figure out, to make sure they have their insurance, to make sure they work with ODH to get their all the licenses up to date, to make sure that we're building and maintaining that contractor pool. That's a little easier of a case to make now in this part of the state, and we actually have kind of an embarrassment of riches. There's a City of Cincinnati HUD grant. There's Hamilton County was just awarded a lead hazard control grant, and there's one in the city of Covington right across the river in Kentucky. There's also a statewide grant in Indiana. So we think there's a good reason for us to help build up the local contractor pool to make sure there's enough folks doing good quality work and that we're getting good quality bids. We move to the next slide, please. So once the bid's awarded, we check on the site. This doesn't replace the field inspections that ODH already does, but it's meant to help make sure people are doing the work to spec, they're using the correct methods, and that we have a chance to work with contractors as they're working through these projects. Next slide. And once the project's completed, we're the ones that do the clearance exam, and making sure that the work was done to spec, that it passes a visual exam and it passes the dust wipe clearance, so we can get the family back into the home as soon as possible. Whatever ongoing maintenance there is, for example, when there's lead paint that is not deteriorated and isn't addressed, we want to make sure the family knows or the property owner knows what their responsibilities are to make sure the home doesn't develop lead hazards in the future. And so we work with that family at the conclusion of the project to make sure they know what their responsibilities are for this program, but also in the future, the things that they can do to keep themselves and their family safe. If they're going to have future renovations, how to interpret the risk assessment so they can actually go through that itemized list of surfaces that were tested, so they know where there is paint that meets the legal definition of lead-based paint. And if it's a rental property, we encourage them to list their properties in the Ohio Lead Safe Rental Registry. So next slide, please. So why did we want to do this? Why did we want to be a part of this program? I mean, for us, it was pretty easy call. we see this as a direct extension of our mission to help people stay safe and healthy at home. There are a number of different environmental contaminants that people are exposed to in a home, especially older housing or substandard housing. To us, lead is one of several things that we need to address in order to help people stay safe and healthy at home. This is very much part of our mission to provide this public service. And we want to be an ongoing resource for people locally. So, this is not a one and done program for us. We want to help connect people to additional services they may be eligible for, whether it's our weatherization program, whether it's the emergency repair program, or other services we may be able to offer families. In a lot of cases, those customer pools overlap. So what are the other things that we can bring to bear that would have an even broader impact on the family's ability to live safe and healthy at home? And finally, we want to help provide lead poisoning prevention, education, and awareness for people that participate. We see the Innovation Center as being a community resource, not just for this SCHIP program, but for other issues related to health and housing. So for example, we're working with a cohort of UC medical students right now who are helping us develop some educational content around lead poisoning that's both for program participants and the community at large, that can be a value add for anyone that lives in a home built before 1978. We want to expand the existing efforts of our local health departments and even our water utility to bridge some of those gaps that exist among organizations and between sectors. So whereas municipalities may be limited in what they can do by statute or by politics, perhaps, as an independent nonprofit, we can kind of work across those boundaries. So we can do work with lead and paint, lead and water, childcare centers, healthcare organizations, other environmental health pieces of our local ecosystem. So another good example of that is that the city of Cincinnati, or the Greater Cincinnati Water Works, has a lead service line replacement program that has cost sharing for low-income families. If we can connect them to that, we can free up SCHIP funds to continue to focus on lead paint in homes in Hamilton County. And then finally, we work with low-income families directly all the time. We have experience doing this type of work. We can connect people to these types of resources, and if the time ever comes where we get through the backlog here for this program, we can connect families that might become potential enrollees for something like this. So I'll stop there after kind of tooting our own horn here. And then the last slide is just my contact information for people that have follow-up questions for us or want to learn more about our individual role here within this program.
Erin, thank you so much. We actually got a question that I'm going to pose to you. If others want to add on, please do so in the last few minutes we have here. Do any of the programs make use of client evaluations of the lead abatement or lead hazard control work? And if so, what kind of feedback are you receiving?
So I'll respond first and then let the other folks deal with that too. So we do customer satisfaction surveys for every service we offer, whether that's volunteer raking their leaves or whether it's somebody replacing a water heater. So we capture some of that just as our standard feedback process. We're trying to make that a more explicit part of all the services we offer so that we can track impact of services, not just client satisfaction, but how much it changes people's lives over the next several months or even year. So we can really quantify what we're doing to improve people's quality of life. That's something that we would love to be able to do and study even for our own purposes. But we have a partnership program right now with a local Cincinnati Children's Hospital that works with families of lead poisoned children in their environmental health and lead clinic. And we've been working with their pediatricians to kind of take their existing feedback that they've got from parents that have participated in HUD programs or even the SCHIP program to figure out what were the obstacles to enrolling, what were the difficulties they had while they were in it. We're trying to build that into our program model now so we can anticipate the challenges that some families have.
Thanks, Erin. Did anyone else want to respond to the seeking or responding to client feedback?
This is Pam. We have the opportunity, at least with VHE, and then we also have the form available for other vendors if they want to use it. It's a satisfaction of work document, and usually our vendor VHE, a staff member, will go with the contractor and they'll do a funnel walkthrough of the property kind of look over a lot of the stuff, and that's kind of their opportunity, at least the owners and the tenants, to go over the work that was done and also discuss anything that might be outstanding or might be concerning at that time. It's also a good opportunity for them to give some feedback as well. But there's also been, many opportunities that we've gotten either some good feedback, poor feedback, just by communication through the owner or through the tenant. So there's no formal evaluation per se, but that we do offer the opportunity for those individuals to provide us with some information during that time, or a review of the work or satisfaction work. And then they'll sign off on the document, provided that they're okay with everything.
Thank you, Pam. Since we only have a minute left, I guess what I'd love to just ask you each to take maybe just 10 seconds and share, if you could make one improvement in how the program's operating, what would it be? What would you like to see change or strengthen in this program to make it more effective? And why don't we start with you, John?
Got me on mute, but thanks for the opportunity. Really, and Pam touched on this, and it strikes near and dear to my heart. I'd like to see all of the work be peer abatement work, and that we're creating homes that are multi-generational, not just putting a Band-Aid or fixing a problem for the next 5 or 10 years, but truly taking these homes and leaving something behind that'll be there for 50, 60, the next 100 years. And it's not a stretch. We really need the workforce, and we need a workforce that's probably a little more considerate of those principles. But as Pam said, we're stretched thin right now, but that's my dream.
Thanks. Thank you. Jerry, one improvement. Got 10 seconds. Excuse me.
7,
I'm sorry.
6.
Looks like we have more time. Okay. I'm not feeling the stress. Thank you for clarifying. Please go ahead, Jerry. You can take more time. You can do one improvement.
No. Actually, as far as what I would change so far, nothing with the S-chip so far. The staff have been great to work with, guiding me and my staff through the process and all of that. I just say, overall, in general, I think one of the challenges that we always look at is everything is set on a timetable. You've got X number of units to complete in X number of months. And so it seems like you are always chasing that timeline. And granted, we try to get all that stuff, everything done as quickly as possible. But sometimes I wonder if it would be better to say, okay, here's this pot of money that you guys get. Use that pot of money, get all that work done, and then move on to the next pot. Because, we always run into challenges with contractors losing crews, getting crews. It takes time to rebuild crews. Obviously, now we're dealing with COVID and all of that. So sometimes it feels like we're always chasing the 8 ball, as opposed to being able to actually really look at, how to properly go through steps. So that would just be one of the things I would like to change, just in general, to most every program, not just anything through ODH.
Thanks, Jerry. Pam, if there's something that you could improve in the S-chip program, what would that be?
Well, I think I mentioned primary prevention. I don't know that I would change anything, but I think, we need to contemplate going forward the primary prevention approach, and maybe reevaluate the initial SPA. I really feel still, after all this time, having worked in the lead industry, the childhood lead poisoning prevention field, that we need to start getting into the primary prevention and having the capability to prevent kids from getting poisoned. And I feel like we're still kind of, it was my hope that we would be into more of the phase 2 activities, but there's still so many kids that are currently lead poisoned that we have to help them. So I really do hope at one time that we've laid the groundwork to start getting and moving in that direction. But that's certainly one thing that I would like to change. Yeah, thank you.
Yeah, and I guess since we have a little more time, is there something that you could see that could accelerate that process?
Well, I don't, money's always the issue, and we've been grateful for the funding that we've received from Medicaid. And I think if we had more, we might have the opportunity to be able to do more of the regional approaches that we talked, getting down on that census tract level, going into communities and looking on a community-wide basis to see how can we improve these high-risk communities and make them better, on not the $50,000 projects. I don't think we can do it with that, but what kind of approaches could we take from a primary prevention perspective to ensure that a child has a lead-safe home? I would love to start going in that direction. I think we always have. It's just, it seems that we still are dealing with a secondary prevention and working with kids who have lead poisoning. And I'm hoping we can start to move forward on that.
Thanks, Pam. We have now a number of other questions, and Aaron, I'll give you a chance to share your one improvement, but let me ask you first, how many contractor companies regularly participate in your lead hazard control program?
So we haven't put our first project out to bid yet. We just developed the specs for the first one here for the SCHIP program. We've got, there are about 4 that are ready, have all their paperwork turned in. There are about a dozen that do abatement work regularly in the area. And we'd love to see that number grow even bigger. I think if we could get, some of the Kentucky firms to get reciprocity to encourage them to do that so they're eligible to bid on projects here, I think that could still grow. And if I can give my quick pitch here,
Yeah.
I would echo Jerry. I think, especially compared to some of the other lead programs we've worked in, we've had a really positive experience working with ODH and with the SCHIP program. I think it's clear that the spirit of this program is very much focused on just doing the right thing for these families. So I don't have a lot of improvements on SCHIP, but I would say in general, I would love to see this type of model where you're looking at healthcare resources and investing them in housing as a way of making a health intervention. And I think that's a movement that's growing for sure. But I think, that the Medicaid, once the dam breaks, using those public healthcare dollars for individual housing improvements, I think there are a lot of other things that we could use those. I know the resources are precious, but I would love to see more healthcare dollars invested in housing, especially given what we know about the impact it can have on health outcomes and other outcomes through other sectors.
Thanks, Aaron, for that. And actually, just one other question to you, and then others may want to respond to this, but there's a question here in the chat that in terms of the social enterprise arm of the organization, how successful has that been in mitigating some costs or helping support the organization? And are there plans to further expand the model?
Yeah, so thank you for that. It's definitely a net positive for the agency in terms of revenue. It's not an independent driver of, it's not enough to independently fund any of our larger programs, for example, but it does help. The other thing it does is it's very much, the learnings we have from the nonprofit side and kind of the private market help reinforce each other. When we have an opportunity to use different products or different setups or a different approach from a fee-for-service customer, those are learnings and efficiencies we can build into the nonprofit side. It's very much meant to self-reinforce. And similarly, the expertise we built up doing this work under very strict cost limitations, usually for the nonprofit side, helps us be more efficient when we're providing the service in the market. So in addition to the revenue, it definitely helps us stay healthy as an organization. And in terms of whether or not we can expand, I think we would love to. I think there's enough room in the market for us to do that. The challenge, and I think with most construction companies now, is finding people that we can train up on these very unique and very specific interventions. I'd make a pitch to anybody to help improve the pipeline of people that are interested in the trades, because it's a really important part of doing quality work for families, is getting the people to do it.
Thank you. John, a question for you is, are you hoping to work with additional communities next year? And also, could you provide some description of the RFP that you put out earlier this year?
Well, certainly, and I'll echo what Pam was saying. Our vision is to expand this out from under ODH and have the participation as evidenced by Aaron and Cincinnati and the Toledo folks. That would be the goal. Right now, $5 million sounds like a lot of money, but once we start dicing it up, it's already not that much money. Pam talks about the primary prevention and those efforts. We've actually identified the eligible or most at-risk census tract in all 88 counties. So, you know, the groundwork's been laid, but I think it's going to take a lot more money to start adding on regional or even county-wide programs. And you know, at the same time, if it's a lot more money, and I wanted to mention this because there is a state match that's required for the federal dollars. When we first had the opportunity three and a half years ago, Medicaid waived the match and gave us a specialized match of about 3%. The reality is Ohio's match is closer to 20%. We're still at a slightly reduced match. I think we're right around 17.5%, but that means the General Assembly needs to produce about 20% of every $1 million. So if it's $10 million, we've got to come up with the $2 million match. Doesn't sound like a lot for that amount of money, but that's where advocacy and that work comes into play. But I'm sure Pam could spend it if we had it.
Well, and another way, I guess, to think about that, though, is that 2 million leverages 8 more million to the state, right? So it's an incredibly cost-effective program, too. One of the questions that came through was, and since you mentioned this in terms of political support for increasing funding, does the potential job creation ability around abatement work, you know, get the interest of policymakers? We certainly hear about the value of jobs and workforce development. Anyone want to respond to that?
Well, I'll take the first hit because it's not just jobs, it's opportunities for individuals to start businesses and to actually build a small business, become an employer with 6 or 8 employees and that type of thing. You know, we receive general revenue funding now to provide subsidized or free training, examinations and licensures to build the workforce. I think what's really missing is that tutelage opportunity of somehow encouraging present contractors and employers to take lead workers on and give them that initial training, that on-the-job training, without that fear of that person then becoming a licensed contractor and competing with them. There's more than enough work out there. And I think as we move forward, people are understanding that. I know just this most past year, we've had over 100 unique contractors actually doing work for bid. And, you know, 5 years ago, it was much less than 50, even though there's hundreds of licensed contractors out there. A lot of them you'll find are consultants and that type of thing, or people like Pam and me that aren't lifting any hammers. But yeah, the workforce development and the fact that it could create small businesses is huge. But that's really something that, like the lieutenant governor and his whole initiative, if I think they were just made aware of, here's another piece to the puzzle that you can add into your menu. And because the infrastructure is already there that his office has created, I think just building that awareness with his office that, hey, here's another little piece that'll help you to be successful in your job creation and small business development.
Yeah, I'm curious, Jerry or Aaron, on a local level, if that prospect of developing sort of work opportunities locally and employing folks locally resonates with local policymakers.
I mean, I'll jump in real quick, Jerry, if you don't
Okay.
mind.
Go ahead. Yep.
So I think I agree with everything John said. I also think that investing in programs like this creates a critical mass of work that needs to be done, and that's what businesses need to invest in their workforce to keep doing this work. I think locally we've had a lead grant for a while, but it kind of 2 years on, 3 years on, 1 year, 2 years off. It's really difficult for a business to maintain the investment they need for licensure and for training and for maintaining their workforce if they don't have a really good expectation of work. Investing in this, especially now and especially locally, it's much easier for us to make the case that lead abatement is not only is it a good thing to do, but it can be profitable, and it's these skills that people learn are transferable throughout the trades. I mean, lead abatement is, home remodeling in many cases, and these are things that will build up the local workforce beyond just the lead abatement pool.
Thanks, Aaron. I know we're just wrapping up here, so I just want to say to everyone, I appreciate your time, your expertise, what you've given to this panel, but also what you're doing out in the community around prevention and lead poisoning prevention with kids and our young ones. Folks, please complete the survey, and for the registered sanitarians, also be sure to put in your information in the chat box. Thanks so much, everyone. Have a great afternoon.